speaking on behalf of the province this afternoon are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Blaine Higgs, Premier ministre de Nouveau-Brunswick. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à toutes et à tous. Good afternoon, everyone. Over the last several days, we have observed a troubling trend, the emergence of new cases of COVID-19, not only in the areas now under public health restrictions, but in every region of New Brunswick, and these include variants of concern. These cases originate with someone who has traveled outside of the province, and often are people who were not traveling necessarily for essential reasons. En temps de pandémie, tous les voyages comportent des risques inhérents. Pour certains, le risque est nécessaire. Ils voyagent pour travailler ou parce que notre protection et la sécurité les obligent à le faire. À l'heure actuelle, les voyages d'agrément comportent des risques que personne ne devrait prendre. Pourtant, certains continuent de voyager pour le plaisir. People leave the province to visit family and friends, spend time in a warmer climate, or just to get away. When leisure travelers return to New Brunswick, our mandatory order requires that they self-isolate away from others and submit to regular testing. It is very important that those who are required to self-isolate do so correctly, away from others in a separate dwelling so that the virus cannot spread through casual contact. But judging by the new cases of COVID-19 we are seeing and the patterns of infection that have emerged, this is not happening as consistently as it should. This is leading to new cases and new secondary infections in every region of our province. Right now, every region of the province except Zone 5, the Campbellton-Restigouche area, has at least one active case of COVID-19. 4 zones have 10 or more active cases, and these new cases come from travel. L'émergence des variants plus contagieux du virus vient compliquer et aggraver davantage notre situation. Avec la souche initiale du virus, il était possible de s'isoler dans une même maison sans que les autres membres du ménage contractent le COVID-19. But with the new strains, infection under those circumstances is almost guaranteed. Until the majority of us have been vaccinated, unnecessary travel is simply too risky. If you do not have to travel, please stay home. If you decide to take that risk, against public health guidance and advice, we need to be sure that you are not putting the health of other New Brunswickers in jeopardy or our healthcare system. Premier Higgs will have more to say on this in a few minutes. Today, Public Health has confirmed 16 new cases of COVID-19 in New Brunswick. There are 8 new cases in Zone 6, which is Bathurst and the Acadian Peninsula. Each of these cases are directly related to travel outside the province. In Zone 1, which is Moncton and Southeast New Brunswick, there are 4 new cases today. 3 of these are related to travel and 1 is currently under investigation. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 2 new cases today. Again, these new cases are directly related to travel. There are also 2 new cases today in Zone 4, which is the Edmundston-Grand Falls area, and these are contacts of a previously identified case. 11 of today's travel-related cases are New Brunswick workers who are currently isolating outside of the province. There are now 148 active cases of COVID-19 in the province. This includes 13 people currently in hospital, of whom 5 require intensive care. And we get reports from the hospital every day about their status, who's stable, who's deteriorating, who's getting off a ventilator. It's a day-to-day report that is quite critical to understanding how things are going with our response and at the most dangerous part of somebody's illness with COVID-19. And while we give you these numbers of active cases and the data, the numbers and what policy decisions we're making, there are people that are hanging on to their lives right now by a thread. So we want to keep those people in our thoughts and prayers. Aujourd'hui, Santé publique confirme qu'il y a 16 nouveaux cas de COVID-19 au Nouveau-Brunswick. il y a 8 nouveaux cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne, qui sont tous directement liés à des voyages à l'extérieur de la province. Il y a 4 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. 3 de ces cas sont liés à des voyages, alors que l'autre fait l'objet d'une enquête. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a 2 nouveaux cas. Ces cas sont encore une fois directement liés à des voyages. Il y a aussi 2 nouveaux cas dans la zone 4, soit les régions d'Edmundston et de Grand-Sault. Ces personnes sont des contacts d'un cas confirmé auparavant. Du nombre de cas liés au voyage qui ont été signalés aujourd'hui, 11 sont des travailleurs du Nouveau-Brunswick qui s'isolent présentement à l'extérieur de la province. Ils sont comptabilisés dans le nombre de cas pour Nouveau-Brunswick. Et il y a présentement 148 cas actifs de COVID-19 dans la province. De ce nombre, 13 personnes sont présentement à l'hôpital, dont 5 sont aux soins intensifs. These New Brunswickers need your support, and I ask that you keep them in your thoughts and prayers as you go about your day. And I think that we do talk a lot about the negative things that are happening, and I know it's really important to hear those good news stories. And with each day, one of those good news stories is about the fact that more and more New Brunswickers are being vaccinated and getting their first dose against the virus. And another good news story, we have 30% of the population have had at least one dose of the vaccine, and that percentage is increasing at about 1% per day. And we know that vaccines potentially reduce the incidence of infection, but more importantly, they minimize the risk of severe illness, hospitalization, and death related to COVID-19, which means that it prevents our hospital system from being overwhelmed. So the more people that are vaccinated, the better. We are working to get as many New Brunswickers vaccinated as quickly as possible. We know that not everyone can get to a pharmacy or a vaccination clinic. Les citoyens du Nouveau-Brunswick qui sont confinés à la maison en raison de problèmes psychologiques ou physiques doivent également être vaccinés pour leur propre protection, mais aussi pour celle de leurs proches. Dans de nombreuses collectivités, des bénévoles offrent des services de transport aux cliniques d'immunisation aux personnes qui n'ont pas de moyens de s'y rendre. Je remercie pour ce beau geste. For people who cannot leave their homes under any circumstances due to their physical or mental condition, additional measures are required. Through a partnership with Ambulance New Brunswick and the Extramural Program, a process is being put in place to identify those who cannot leave their homes for medical reasons and providing them with an opportunity to get a vaccine. Persons over the age of 55 who are homebound for medical reasons are eligible for this program. A homebound person's primary care provider can apply to the extramural program for assessment, with referrals to be taken beginning the week of May the 3rd. Les clients actuels du programme extramural seront également évalués pour déterminer s'ils sont admissibles à de l'aide. Des vaccins seront administrés dès que les lots de vaccins ne nécessitant pas de procédure spéciale d'entreposage et de manutention deviennent disponibles. By providing a vaccine at home to those who are unable to get out for medical reasons, we will be helping to assure that no New Brunswickers are left behind in our journey through this pandemic. And I want to offer my thanks to every New Brunswicker who is helping us get through this stage of the pandemic right now. By getting vaccinated, when your turn comes up, you are doing your part. By wearing your mask when you're out in public, you are doing your part. By not traveling outside the province, if you do not need to travel, you are doing your part. And if you do have to travel and come back and self-isolate safely and you don't infect others, you are doing your part. So by staying home when you don't feel well, you are also doing your part. Getting tested when you have symptoms is also doing your part. So even no matter how trivial the symptoms are, getting tested is very, very important and is really contributing to you doing your part, as well as protecting your community and the hospital system. So if we all continue to do these things for a few more weeks, and I mentioned the target date of about 10 weeks from now before we get everybody vaccinated with their first dose, we will all be in a better position to keep COVID at bay. By maintaining these practices, you will help us get through the next stage of our pandemic journey. Thank you very much.
Good. Good afternoon. Bonjour. Since this pandemic began, we have known that COVID-19 is spread through the movement of people. The more we have been able to reduce the movement of people, the slower the spread to the virus. This is even more critical now. Cela est d'autant plus important depuis l'apparition de nouveaux variants de la COVID-19, puisqu'ils se propagent plus rapidement et facilement. Nous avons vu cette situation dans d'autres provinces. Bien qu'il soit impossible de complètement arrêter les déplacements à l'intérieur et à l'extérieur de la province, nous devons prendre des mesures afin de limiter la propagation du virus alors que nous continuerons à vacciner les gens. Currently, 31% of New Brunswickers have received at least the first dose of the COVID-19 vaccine, and we are increasing that number at a rate of approximately 6,000 to 7,000 per day. We feel that by late May, we will be in a better position as a province to be able to keep residents healthy and safe while not putting undue strain on our healthcare system. To give our province the time and space required to be in a better position, Cabinet and the All-Party Cabinet Committee on COVID-19 have agreed to the following isolation recommendations. Effective at 11:59 p.m. on Saturday, all leisure and non-essential travelers, every person approved to move to New Brunswick, and all business travelers who are not rotational workers, truckers, or commuters will be required to isolate for at least the first 7 days of their 14-day isolation in an isolation hotel at their own expense. This rule applies regardless of whether or not the traveler has been vaccinated. Isolation hotels will be located in Fredericton, St. John, Moncton, Miramichi, Bathurst, Campbellton, and Woodstock. Currently, there are no isolation hotels in the area under lockdown. These hotels will be coordinated by the Canadian Red Cross, which will also provide meals, attend to medical needs, and provide 24/7 security. It is expected that the cost to each traveler will be about $200 per day. For direction on which hotel you should go to upon arrival, call the travel registration number at 1-833-948-2800, and an agent will assist you. On day 5 of the hotel isolation, the traveler will take a COVID-19 test, with the results expected on day 7. If the traveler tests negative for COVID-19, they can finish their 14-day isolation at home, as long as no one else is there, and on the condition that they must also test again on day 7, on day 10. Travelers must travel from hotel to home alone or by taxi, but always following the public health measures when they are traveling. No family pickups or carpooling is permitted. Peu importe les exigences du gouvernement fédéral en matière d'isolement après un voyage. Une fois que vous entrez au Nouveau-Brunswick, vous devez suivre cette exigence à la lettre. The practice of hotel isolation is expected to remain in place until late May. Also effective on Saturday at 11:59 p.m., new rules will apply to every New Brunswick resident who leaves and returns to the province on a regular basis, including truck drivers and commuters, with the exception of rotational workers. Once they return to New Brunswick, this group of travelers will need to stay at home, except as needed to meet medical needs or to obtain the necessities of life, as long as they can do so without contact with others, such as by using curbside pickup or delivery. Cette règle s'applique peu importe si ce groupe de voyageurs a été vacciné ou pas. Les membres qui font partie d'un ménage de voyageurs ne sont pas obligés de rester à la maison, mais ils devraient limiter le contact avec les voyageurs puisqu'il y a des risques. Ils devraient éviter tout contact autant que possible pour des raisons de sécurité. After 14 days at home, truckers and commuters can leave their home as their health zone phase allows. All of these isolation requirements will be reevaluated weekly, but are expected to remain in place until near the end of May. Upon their return to New Brunswick, rotational workers will need to self-isolate for 14 days. If they choose to isolate with their family, then everyone must self-isolate for the full 14 days. Like everyone who is coming into New Brunswick, truck drivers will now need to register to re-enter the province. Il y a la possibilité de s'inscrire à la frontière, mais cela vous ralentira. Vous voudrez peut-être vous inscrire en ligne à l'avance. There will also be an increased presence of peace officers at Olac on the border between Nova Scotia and New Brunswick. Students returning to New Brunswick from anywhere in Atlantic Canada that is considered to be in a hot zone. Currently, this includes the Halifax Regional Municipality, as well as anyone who is with them and helping them move must self-isolate for 14 days, effective immediately. As of Sunday night at midnight, students returning to the province from a hot zone will be required to isolate in a designated hotel at the province's expense. As with other groups, they will be tested on day 5 with the option of finishing at home starting day 7 if the test is negative. This program will be overseen by the Canadian Red Cross, and information will be provided when students register to return to New Brunswick. Minimum fines are increasing from $292.50 to $580.50 for those who violate the mandatory order. And I appreciate, while in many areas throughout our province, in most areas, we have a high degree of compliance, in the 90%, 95%, sometimes higher. The criticality of the situation today necessitates an urgency around any following of the rules. We must ensure that we are following health rules like never before, because a single miss can have such a dramatic impact on our entire province. There are also, we know, some that aren't taking the situation seriously. And while, as Dr. Russell explained yesterday, and while the COVID rules that we have in place may have been extremely effective with COVID as it once was, with the variant, it is much more critical for us to take additional due care and attention. I understand that we've provided a lot of information today. We've done so quickly. We've spent time with our COVID cabinet colleagues and our cabinet colleagues, and we've certainly reacting to the situation that we're finding, not only in New Brunswick, but throughout the region. What we're seeing right now in Nova Scotia, what we've been seeing for weeks in Ontario and in Quebec, and we have 10 weeks in order to achieve success here. We have vaccines that are coming now at an unprecedented rate to what we had seen in the past. We can vaccinate 45,000 a week easily, and we can go beyond that if the vaccines allow that to happen. We're optimistic we will be able to increase our capability because vaccine supply will also increase. But right now, if you don't need to come to New Brunswick, don't come here. We want you, just not right now. If you can delay your move to our province by a month or so, then please do so. If you don't need to travel, stay at home. If you are, for example, currently at a resort in Florida and are able to stay there for another month, please do so. The risk to you and to everyone you come into contact with is simply too high. Back when this pandemic began, the federal government, along with our provincial government, sent a clear and consistent message. Do not travel. Ce message n'a pas changé. Si vous avez pris la décision de voyager, même si on vous demande de ne pas le faire, vous avez pris la décision d'augmenter vos risques de contacter ces virus. We are trying to minimize the risk of you bringing the virus to New Brunswick and spreading it further. The plan is not perfect, and we're still working out the details, but these steps are necessary. Notre but est de garder notre province dans la phase de l'adaptation autant que possible. En même temps, nous aidons à nous assurer que notre système de soins de santé ne devient pas d'abordé. We are seeing that happen right now in Ontario, where healthcare professionals are being forced to make heartbreaking choices about who receives care and who doesn't. We cannot let that happen here. These isolation requirements are not forever, and we must realize, although we're all tired of COVID, we just need to stay vigilant, and we just need to do so for another 10 weeks at minimum. But we know that we will need to continue as we all get vaccinated. But I'm still counting on summer. And right now, the summer starts July 1st, and that's going to be our focus. But can we achieve it? We can only do it together. And we can do it if we're vigilant, and we can do it when you take vaccines when they're offered to you. We need to reach that threshold. In approximately 30 days, we hope to be in a place where we're able to ease restrictions or to reevaluate our situation. De plus, nous réévaluerons ces restrictions régulièrement et nous ferons les changements nécessaires pour garder les gens de Nouveau-Brunswick en santé et en sécurité. Today, Cabinet and the All-Party Cabinet Committee on COVID-19 also made the decision that high schools will not be returning to a full-time in-person learning this school year. Given what is going on around us, it just didn't make any sense to change at this time. I want to take this opportunity to thank all the healthcare professionals in our province and those who have recently stepped forward and offered to go to Ontario to assist that province with their response to COVID-19. I am proud to say that New Brunswickers are always ready to help out in any way they can, and we continue to demonstrate that in every way. Of those who have expressed interest, we've identified approximately 27 who have looked at going, and they're being evaluated now in terms of the needs in Ontario and in terms of their availability. We will be forwarding a list of available resources to Ontario today through our mutual aid protocols and anticipate that some of these people will be called upon in the coming days based on the need in Ontario. I also want to thank the truck drivers who continue to work so hard to keep goods flowing into and out of our province. It is important that the truck drivers who regularly cross borders into other provinces and the United States remain healthy. That is why we continue to make them a priority and have even increased that in the last several weeks. I am pleased to report that more and more truckers have been signing up to get vaccinated. Truckers, thank you for your service throughout this pandemic as we continue in these late stages of the pandemic and the view to looking forward to better results in the near weeks and months. Please continue to protect yourself and to get vaccinated. And although the current rules and the changing rules are not easy, we respect that. But it's all in an effort to keep you safe and to continue to keep our residents safe. Unfortunately, travel-related cases of COVID-19 continue to increase, and the variants are putting New Brunswickers at risk. By taking swift and decisive action, we will reduce the risk of infection and protect lives while we continue our vaccine rollout. Rien de tout cela n'a été facile, mais nous faisons de progrès. J'encourage tous les membres à continuer à travailler ensemble afin de s'assurer qu'ils sont en santé et en sécurité, tout comme leur est chez leur communauté. If you are eligible for a vaccine, make your appointment and get one. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre, Dr. Russell. Thank you, Premier and Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Harry Forrestal, CBC. Harry Forrestal. Nick Moore, CTV.
Thank you very much. This recommendation that is changing about AstraZeneca this afternoon, that it can now be offered to people 30 plus, how is that going to affect the rollout of the vaccine in New Brunswick?
Hi, Nick. Well, as of right now, New Brunswick is going to stay the course with the 55 plus. All of our clinics really with AstraZeneca have been planned out with that age group in mind. We won't be getting any more AstraZeneca till probably the end of May at this point in time. And as of right now, we're going to use the risk-based approach that is recommended by NACI around our epidemiology. So as of right now, again, we're going to stay the course and see what things transpire over the next several weeks. But again, we won't be getting any more AstraZeneca till the end of May.
Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. Can you explain again what percentage of vaccinated people will mean we've reached herd immunity, and what will continue to be prohibited until we reach that 75%? Or
Well,
whatever it is.
So it's a bit of a moving target. Prior to the variants of concern being at play, I think we were looking at something like between 60 and 70%. Now that the variants of concern are at play, we're looking more at 75%. But again, that can keep changing based on what we get from other jurisdictions who have completed their vaccination. So places like Israel, their whole population is probably at herd immunity right now with respect to their 2 doses of Pfizer being on board. So the data that we're getting from places like that in terms of what kind of breakthrough infections exist, et cetera, that will tell us what types of public health measures will remain in place and which things can be relaxed.
Thank you. Colin Smith, Global News.
Hi there. Premier, I'm wondering how the decision was made for the hotel isolation requirement, and I guess how you expect that to evolve moving forward.
Well, certainly the decision was made because of what we're seeing around us and the rapid explosion of cases when the single, let's say, variant, particularly related infection shows up on the scene. We've had some cases of that where isolation was supposed to have happened and it did not. Obviously the tremendous high percentage of our cases are travel related. And so to ensure that we do not miss travelers and to ensure that they do isolate as required, we believe this protection is required. And that's why it became a consensus within our team and the COVID cabinet and cabinet committee that we just must exercise everything we can right now to minimize exposure. If we were back to COVID as normal, we probably would have said, well, we can carry on as we have been because that's been successful. But right now, we have seen, and I've referenced them today, the situations and how quickly it changes. So we're at the home stretch. We've got, the 10-week until we believe we can be in a position to have 70, 80% of our population with at least the first dose, which can be a game changer for us. And so people just need to, take this last kind of interruption in our life and say, look, we can do this, we can bear down, and we've got to do everything. We can't look back in a few weeks' time to say, what else could we have done? We want to always be able to look forward and say we did everything when we needed to do it at the time we needed to do it. And as a result, in July 1st, summer is returned to New Brunswick.
Michel Corriveau, Radio-Canada.
Oui, bonjour. C'est une question pour Dr. Russell. Dr. Russell, le Premier ministre a expliqué assez clairement quelles seront les nouvelles règles à partir de dimanche minuit pour les gens qui voyagent. Est-ce que vous pourriez nous expliquer, pour le bénéfice de nos auditeurs francophones en français, ces règles-là? Qu'est-ce qui va être mis en place à partir de dimanche à minuit?
Alors, je crois que pour les gens qui travaillent, qui voyagent pour des raisons non essentielles, à partir de le 24 avril à 11h59, ils vont falloir isoler dans un hôtel pendant 7 jours. À jour numéro 5, ils vont avoir un test et après ça, ils peuvent continuer leur auto-isolement après ça à la maison. pour les travailleurs qui sont pas des travailleurs de rotation, ni des camionneurs, ni des gens qui voyagent chaque jour à travers les frontières. Ça commence à 11h59 le 24 avril aussi. Et ça, c'est les 7 jours dans l'hôtel avec un test sur la 5e journée. Et après ça, ils peuvent continuer leur auto-isolement après ça à leur propre maison. Pour les étudiants qui étudient dans l'autre province des provinces atlantiques, quand ils sont, s'ils sont de retour avant le 25 avril à 11h59, c'est pareil comme que ça existe maintenant, mais après le 25 avril à 11h59, il faudra qu'ils font leurs 14 jours de auto-isolement à la maison. Les gens qui viennent de les provinces atlantiques, mais leur hot zone à Halifax, ça veut dire que ça va commencer immédiatement. Quand ils seront de retour à Nouveau-Brunswick, il faut faire leur auto-isolement à la maison en commençant immédiatement. Et après, s'ils arrivent ici au Nouveau-Brunswick d'un hot zone de Halifax après le 25 avril, il faudra faire leurs 7 jours à un hôtel de auto-isolement, se faire tester le 5e jour et ils peuvent continuer le reste de leurs 14 jours à la maison après ça. Les étudiants qui viennent de le restant du Canada, il va falloir faire leur auto-isolement dans un hôtel à partir de le 24 avril à 11h59. Comme j'ai dit, c'est 7 jours dans un hôtel, test 5e journée et ils peuvent, si c'est négatif, ils peuvent continuer leur auto-isolement à leur maison. Des individus qui voyagent pour des raisons compassionnantes, qui sont déjà en hors du province, il faudra qu'ils fassent leur auto-isolement à la maison pour 14 jours après, à partir de le 24 avril à 11h59. Et les gens qui voyagent en hors du Nouveau-Brunswick pour des raisons compassionnantes après le 24 avril, après ça, quand ils seront de retour, il faut faire leur auto-isolement pendant 7 jours dans un hôtel, un test sur le 5e jour et si c'est négatif, ils vont continuer leur auto-isolement pour les prochains 7 jours à leur maison, à leur propre domicile. Pour les individus qui voyagent en hors du Nouveau-Brunswick pour des raisons médicales ou pour des raisons des arrangements avec les enfants légaux, il n'y a pas de changement. Les individus qui voyagent en hors du Nouveau-Brunswick, il y en a des gens qui sont en train de faire leur auto-isolement en hors du province. Il faut se faire tester et quand ils vont retourner à Nouveau-Brunswick comme un voyageur qui fait qui travaille comme un travailleur rotationnel, eux, il faut compléter leur auto-isolement ici à Nouveau-Brunswick dans un hôtel et faire le test sur la 5e journée. Et pour les gens qui voyagent d'un endroit international, après qu'ils vont faire leurs 3 jours en quarantaine dans un hôtel et leur test est négatif, il faut compléter 14 jours ici au Nouveau-Brunswick dans un hôtel. Et ça, c'est à partir de le 24 avril. Et les gens qui voyagent d'un endroit international, après qui vont faire leur auto-isolement de 14 jours dans un endroit de quarantaine fédérale. Après ça, ils vont pas avoir besoin de faire un auto-isolement ici au Nouveau-Brunswick après ça.
Savannah Ott, Telegraph Journal.
Hi there. My question is for Dr. Russell. I'm wondering if you can quantify how much of a problem these leisure travelers are actually creating. Do you have, I guess, the percentage of cases this month specifically from leisure travel? And on average, how many people became infected from those leisure travelers?
So we actually have the percentage of cases that come from all the different types of travel, how many and how many secondary cases they generate. So we have that data on all travelers for the last several months. And basically, the risk, because of the variants of concern right now, are much more elevated than they were prior to the arrival of the variants of concern. So anything that we can do to mitigate those risks right now, anything that we can do to minimize those risks translates into, very directly, fewer cases that are hospitalized and fewer cases that are requiring ICU and ventilation and fewer deaths.
Thank you, Ms. Odd.
But
Vicky
I'm not
Hogarth,
asking for
CHCO.
travel related, I'm asking for leisure travel related specifically.
I do have that data, and we can provide that to you, so we can check with Bruce after.
Vicky Hogarth, CHCO-TV.
Thank you, Bruce. Dr. Russell, what do we know at this point about the B1617 double mutant variant first detected in India? What exactly does double mutant mean, and are vaccines less effective against it? And is its presence in Canada part of the new travel restrictions we're seeing today?
Hi, Vicky. So what we know about the variant from India right now, all variants of concern meet the same criteria around being more aggressive, being more contagious, and causing more symptoms that are more serious, requiring hospitalization and ICU admission and possibly death. The other thing that all variants of concern share in terms of what meets the criteria of a variant of concern includes the risk of not necessarily being as that vaccines may or may not be as effective against them. So these are risks that we take very seriously when we're looking at variants of concern, and the fact that the UK variant took over in the UK very quickly. It's now the dominant variant in Ontario. The Brazil variant has arrived in British Columbia, and now we're seeing the India variant in several provinces of this country, and we do anticipate that it will do the same as the other variants in terms of taking over as the dominant strain. The fact that the India variant has 2 different mutations on it that make it more contagious, more transmissible, have more severe symptoms, requiring more people to be hospitalized, is very, very concerning, because we already have been dealing with the UK variant in Zone 4, which has put more people in the hospital, requiring ICU admission and ventilation, et cetera. So we are definitely very concerned, and those risks are much higher right now, and therefore all the things that we need to mitigate those risks have to match that. And so that's why we are putting all of these measures in place right now.
Thank you. Simon Delatte, l'Acadie Nouvelle.
Oui, une question pour la Dr Russell. Je voudrais savoir, les cliniques de vaccination semblent moins se remplir dans la zone 4 cette semaine. Est-ce que la santé publique considère étendre la vaccination dans la zone à d'autres catégories de population, puisque une plus grande partie de la population a déjà reçu une dose dans la zone 4?
Je ne sais pas si j'ai tout compris votre question. Vous voulez savoir s'il y a des cliniques de vaccins qui sont complétées, qui sont pleins? Parce qu'on sait qu'il y a des cliniques de vaccins, parce qu'on dirige des vaccins à la zone 4, parce que c'est un endroit où il y a des éclosions à ce moment-ci. Et on va continuer à diriger un pourcentage des vaccins qu'on peut, mais à ce moment-ci, je crois que les cliniques de vaccins sont presque pleins.
Est-ce que vous considérez étendre la vaccination à d'autres groupes dans la zone 4?
Il y a des espaces disponibles pour demain, je crois, mais est-ce que vous voulez savoir si on croit qu'on a... Je ne comprends pas la question, je m'excuse.
Simon, on va t'attendre, on va procéder à une autre question. Harry Forstall, CBC.
Thank you, Bruce. Thank you, Premier and Dr. Russell. Premier, yesterday, you made remarks regarding the number of long-term care workers who have been vaccinated. You said only 59% of LTC workers have agreed to be vaccinated, which suggested there was resistance there. Perhaps they were refusing. I spoke today with the Nursing Home and Long-Term Care Homes Association. They say that it isn't that workers are refusing, it's that unlike other jurisdictions, workers at LTC homes and nursing homes weren't among the first to be offered vaccine, and there are a number of difficulties that have contributed to them not being able to get vaccines. Can you tell me what solution the province has to this particular problem of a third of the workers who care for the most vulnerable in the province have not or may not be able to get vaccines?
Well, firstly, I'm glad to hear the response that it's not about individuals refusing. It's about having the opportunity for vaccines, because we have the vaccines available. Just like they were available to the home care workers at the time that the long-term care workers were being treated. The whole staff were being treated at the same time and vaccinated. So the supplies have been available, will continue to be available, and now we're contacting each home. And I would say, have the homeowners and management contact us if that's, because we'll be on their doorstep with vaccines, or be showing them directly where to go. Because if we're fully aligned, which it's wonderful news that the home care workers want to, or the healthcare workers of long-term care facilities want to be vaccinated, we want them to be vaccinated, so we're all on the same page. And if there's a concern that they didn't have that opportunity, well, we'll remedy that, because we have lots of vaccines to ensure they are vaccinated, because healthcare workers, long-term care workers were a priority from very early on in this process. So great to hear. We'll certainly focus and work with them very closely.
Sophie Deshotel, Radio-Canada. Stefan Sinclair Fortin, All New Brunswick.
Hi, this question is for Dr. Russell. I was just wondering if you could tell me how much AstraZeneca the province has left in stock, and if the province is having any trouble getting rid of it.
We definitely are not having trouble getting rid of it. We don't have a ton of it left. I think there was only about between 1,200 and 2,000 doses left before the next shipments are expected, and those clinics are all scheduled, and my understanding is they're not having trouble filling them up.
Thank you. Sophie Deshotel, Radio-Canada.
Oui, ma question est pour soit le Dr. Russell en français ou M. Higgs en anglais. Savoir pourquoi il n'y a pas d'hôtel à Edmundston, et aussi pour comprendre comment vous allez faire la vérification si les gens vont effectivement se rendre à l'hôtel, parce que quel genre de contrôle il va y avoir en place pour être sûr qu'ils respectent cette consigne-là.
Okay. The only reason there's not one in Edmundston right now is because the region is locked down. As soon as that changes, and we would like to think that will change in the near future, then we'll certainly be setting up with a hotel in Edmundston. And in relation to how we track people, well, anybody that comes into the province has to register. So now we're able to, and we have been able to disseminate of what particular reason they're here, and then what is necessary in order to ensure that they isolate. So that's how we have contact. We know who's coming, and we will direct them in addition to our number that we have for them to call, so there's no confusion. We will direct them and to the Red Cross in the particular location that works for them, and then the Red Cross kind of take it over from there in relation to how they're looked after.
Thank you. Merci beaucoup. Marie Sutherland, CBC.
Good afternoon. My question is for Premier Higgs. This mandatory hotel isolation is quite short notice for leisure travelers who are arriving home tomorrow night or Sunday morning. So they'll now have to scramble to get a hotel and change their isolation plans. I'm wondering, will there be any leeway on issuing fines for people who can't change their plans at the last minute?
The difficulty that we're into here right now is that in terms of leisure travel, we've been saying for well over a year now, please don't travel. Please do not travel out of the country. Please do avoid unnecessary travel. Leisure travel would fall into that category. So I know there's an imposition with individuals coming home, but I equally know that there may be options, that they can change their schedule. And if they can't, we have to be sure that we protect the rest of the population and they don't bring something more home than their suitcase. So the point that we actually say, look, we've got to change the rules. We've got to instigate a tighter regulation. is because we can't have this variant coming in from what otherwise might be an unsuspected source. And even though we recognize that many can go to their home and they're able to isolate there, we have seen that in the past while that is not the case. There's many stops made on the way, got to pick up groceries, got to, visit friends or talk to them, and we've had problems. Well, when COVID was as it was before, we could live with that, or we managed to live with it, I should say. But right now, it could be a game changer. So yes, it's inconvenient, and I know that it's being, we're maybe being difficult. But right now, we're focused on the end game. And we're focused on doing whatever we can to ensure that we get to the finish line and the touchdown is scored and we're able to move on with summer in New Brunswick.
Thank you. Jean-Philippe Hughes, Radio-Canada.
Ça va être correct pour moi, Bruce, merci.
Alexander McDougall, Bolton Pioneer Times.
So my question is for Premier Higgs. I just had a question regarding, I don't know if you had heard anything regarding a potential use of vaccine passports now that our public is vaccinated. I'm sure with returns to, with regards to the U.S. can, I'm sure that's more of a federal thing, but I didn't know if you had heard of anything planned for either provincial travel or maybe for allowing dual citizens or family members to enter New Brunswick.
So we've had some discussion federally in relation to my colleagues in the Prime Minister's office in relation to vaccine passports. Nothing that's been concluded and that I'm certainly familiar with, but the reality will be that our focus is, can we get to a point where we have equal vaccination levels on both sides of the border? And that was primarily, the question that we were putting to the Prime Minister a week or two ago, when the U.S. had announced that they were moving their schedule. When President Biden announced that he was moving the schedule up by, I think, several weeks to April 19th for everyone having a vaccine, at least one over the age of 18, I think, was the announcement. Then it appeared that extra vaccines would be available. And it does appear that. We're seeing more vaccines from Pfizer, so it seems that's happening. The obvious opportunity is for Canada and the U.S. to become vaccinated at equivalent levels, so we once again can open our borders as we have all been used to. So this last year has been a big imposition for not only trade, which we've managed to work with, but individuals and families and friends and communities shopping in one community or another. So we want to get back to all that, and I think the focus is going to be, let's get vaccinated to the same level, and I think supply is going to be there to do that, and that will be the focus. And whether we get to a point of vaccine passports, let's hope it's not necessary. And I think our focus is let's get the next 2 months in vaccines in arms.
Thank you, Premier. Thank you, Mr. McDougall. Mariette Brassard, Radio-Canada.
Oui, bonjour tous. Ma question serait en fait pour le Premier ministre Higgs. Ma question qui est la suivante. Il y a eu des discussions de peut-être demander au Maine, donc à l'État voisin, à savoir s'ils pouvaient envoyer au Nouveau-Brunswick des doses de vaccins. En ce moment, avec l'information qu'on a eue, ils n'ont pas l'air à être en faveur d'envoyer des doses de vaccins au Nouveau-Brunswick. Je voulais savoir ça va avoir quel impact sur le plan de vaccination si le Maine refuse d'envoyer des doses au Nouveau-Brunswick.
No, first of all, our vaccination plan is based on what information we have that public health has provided in relation to security of supply. So everything we're projecting right now to the end of June is all based on what is committed. Anything beyond that is a bonus. So the fact of our discussions with Maine at a very preliminary level, but I appreciate right now they are doing just what we would be doing and are doing, is we're working with what we have and we're focused on our provinces, they're focused on their state. And what the conversation was, just to introduce the discussion that we have so much exchange of activity between our borders here and between Maine and New Brunswick, is that it is beneficial for us to be vaccinated at the same level and be able to meet that standard. So we just feel that vaccines are more available in the U.S. We know that we could vaccinate at approximately twice the rate if we had the vaccines available. But I know the situation they're in, and I know they're working hard to get their population vaccinated. I don't expect to see any surplus vaccines from them for many weeks. But it could come in late May or June, but it'll depend on where they are with their own population, and I wouldn't expect them to obviously be any different in their decision-making.
Bob Montembeau, dernière question.
Oui, bonjour. La question est pour Dr. Russell. Lorsqu'on regarde ce qui se passe en matière de vaccination dans d'autres provinces, au Québec, en Ontario, par exemple, on voit qu'ils sont un peu plus avancés qu'ici. Par exemple, au Québec, l'AstraZeneca est offert pour les 45 ans et plus à l'heure actuelle, alors qu'au Nouveau-Brunswick, c'est 55 ans et plus. J'aimerais que vous me disiez, là, d'un point de vue un peu plus élargi, comment on explique que d'autres provinces sont plus avancées que nous et comment ça se passe, la vaccination ici?
L'effet d'avoir un changement de l'âge entre des provinces pour l'AstraZeneca, ça n'a pas un impact du tout sur le plan de déroulement de vaccination. C'est basé sur les âges et la situation est vraiment différente dans les autres provinces. Mais ici, au Nouveau-Brunswick, le pourcentage de vaccins qu'on a du niveau fédéral, c'est le même pourcentage pour chaque province au niveau de la population. Et fur et à mesure qu'on reçoit des doses, c'est presque moins d'une semaine entre le temps qu'on reçoit les vaccins et qu'on peut vacciner les gens. Alors, c'est vite fait ici. Je ne crois pas qu'avec le pourcentage qu'on a, c'est équivalent de toutes les autres provinces au niveau des pourcentages. Et fur et à mesure qu'on les reçoit, c'est presque moins d'une semaine qu'on les reçoit et que c'est donné à notre population basé sur l'âge.
Merci beaucoup. Merci beaucoup tout le monde. That concludes today's update.
That concludes today's COVID-19 update for New Brunswick. Just to recap, there were 16 new cases of COVID-19 in the province today. I do have the breakdown now. 4 of those cases were in Zone 1, 2 were in Zone 2, 2 were in Zone 4, and 8 were in Zone 6. Now, 11 of those cases, Dr. Russell said, were related to temporary workers, I do believe, coming to New Brunswick who are already isolating, and I do believe they're isolating outside of the province. We heard a lot about new travel restrictions, in particular for leisure travel today. Now, starting Saturday at around midnight, people who travel for leisure who are returning home will have to stay for a minimum of 7 days in an isolation hotel at their own expense, and these hotels will run about $200 a night. On day 7, they'll be tested. If they test negative, they can return home for further isolation, provided they live alone. I will be posting more information about these details on our Facebook page as soon as I receive them from the province. Thank you for joining us today for what was a very long conference. I appreciate your patience. I'm Vicki Hogarth from the CHCO News Desk. I'll see you next time.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.